name is Mrs. Gerke, and today we are going to learn about the donning, which means putting on, and removing of gloves. That's all part of the personal protective equipment, or PPE as it will be referred to, throughout all of your learning in your nurse's aid training. There are various types of personal protective equipment that we will use that you will use in your whole career as you stay in this or whatever you're learning. The personal protective equipment is used for medical asepsis, which means, in other words, preventing the spread of any growth of bacteria, spreading bacteria, growth of infection. Okay, the most common thing we use, of course, is the gloves. There are also gowns that are considered part of the PPE. Gloves are made out of a latex rubber, they are made out of vinyl, they are made out of plastic. The latex rubber here, I don't think we have any of them right now. Most of these are the plastic gloves. These are latex powder-free exam gloves. Wonderful for when you do put them on. They fit very nicely on your hand. And then we also have powder-free gloves. Okay. At any rate, what I want to tell you here now, the gowns are most commonly used by healthcare professionals when they need more than just hand protection. If you go into a room where there possibly would be a wound that is unpredictable, where there may be a lot of drainage, then you will maybe possibly have to put a gown on. But your instructor that is with you or the nurse on the floor will take care of letting you know if gowns are necessary. Okay, what else can we tell you? I think you have to know what size works best for you. Gloves cannot be too tight because then you cannot work with them properly. They can't be too loose, as then you can't do little detailed things and they will slide off of your hand if they're too loose. You cannot function properly if they don't fit properly. If by any chance you happen to tear a glove when you're putting it on, please remove it because it is not effective. It cannot be a barrier at that time. You have a hole in your barrier for the bacteria. In most cases, we do wash our hands before we put the gloves on, and you know all about your hand washing technique. Then you would put your gloves on and go in and take care of the patient as you are. You don't do that until you are in the room, next to your patient, next to your resident. If you are going to just simply walk in the room, hand the resident something, fix something on the bed, if there's no contamination around, like a wound or anything like that, you do not need to have a glove on. Okay, also, when gloves are made from other materials, if you are sensitive to the latex, please let your instructor or the nursing facility know because they will provide some of these other gloves for you. Okay. Well, I guess we can, let me show you here. All right, this is a large glove. Simple to get on. You put gloves on any way that, just like a regular glove. But this one is large. This is not going to work if you have detailed work to do. This one fits. That is the importance of having proper fitting equipment. Okay, also gloves are only worn for one time. And after you are finished doing your work with your patient, you do remove the gloves, and we are going to go through that here shortly. You do remove the gloves, and they get thrown away into the receptacle that is there for them. Do not touch any light switches, do not touch any door handles with a contaminated glove. Once you are done with your patient care, the gloves come off. And then you can finish what you're doing in the room, but you need to wash your hands after the glove is removed. Okay, well, we'll come over here then. What else can we say about the gloves? They also, for part of the personal protective equipment, they have the gowns, you have the gloves, you also have eyewear that can be worn, and you also have facial masks. That would be later on when we go over something different if you have an infectious patient. Today we're simply going to look at how to remove our gloves. Okay, if you will pull up your checklist, please. And we're also going to refer to, I believe it's page 246 in your book if you have any questions. Very simple procedure, but it must be done properly. Okay, we have, here, let me get one that fits right. And this is a receptacle here to get rid of that glue. You have your gloves on. If by any chance you are wearing a gown, you make sure that the cuff of your gloves is put over the cuff of the gown so that there is no bare skin in between the gown and the glove. You want to be where you're not going to be spreading any type of an infection. Okay, we have our gloves on. We have done what we need to do with our patient. We have either adjusted something in their bed that needed to be done, and or maybe you're brushing their teeth for them if they have dentures. You wear gloves when you do any type of oral care, any type of where there's a bodily fluid. If you're dressing someone and they need depends or something like that, if you're removing depends or whatever, you make sure that you have your gloves on. If you are simply adjusting a sweater on them that they're wearing over their clothing, you need not put gloves on for that. Okay, we have our gloves on. We've completed our task. We're going to take them off. You take whichever hand is your dominant hand. Remove the glove from the opposite hand by pulling from the middle of the palm. You pull that down. That's not supposed to happen. You pull that down. It gets held in this hand. You take your 2 forefingers from the other hand and pull the cuff over the hand and over the glove. You now are ready to totally dispose of that into the proper receptacle, after which you wash your hands. Come over and wash your hands again, as you know how to do that with your hand washing technique. And checklist is there. As you read over that, with the gloved hand, you grasp the other glove at the palm as we did. Keep the glove you have removed in your gloved hand. Slip the 2 fingers from your ungloved hand underneath the cuff of the remaining glove. Pull that down. You now have both gloves together. That's when you dispose of them. Wash your hands. Okay. You have your book to refer to. And do we have any questions? And otherwise, please let us know. Hope all goes well. Thank you.